Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Epithelioid hemangioendothelioma. Epithelioid hemangioendothelioma is also a soft tissue tumor of endothelial in origin. It is of it has a it has two types. Okay, we have two types of epithelial hemangioendothelioma. We have an infantile variety which is a benign form, and we have malignant variety also, which is very malignant, and it is highly aggressive. Female preponderance is seen in the patients with familial hemangioendothelioma, that is, females are more commonly seen than males mainly because it is related to the exposure to vinyl chloride and oral contraceptive pills. So, in approximately half of the cases, cutaneous hemangioma is present. In half of the cases, cutaneous hemangioma is also present. Then, pathology of the epithelioid hemangioendothelioma. So, pathology of epithelioid hemangioendothelioma are factor 8 staining. Factor 8 staining differentiates this epithelial hemangioendothelioma from other non-vascular tumors, because this is a vascular tumor, right? Epithelioid hemangioendothelioma is a soft tissue tumor of endothelial origin. So that is, it is a type of vascular tumor. So this factor 8 staining will differentiate this epithelioid hemangioendothelioma from the other non-vascular tumors. Liver parenchymal architecture is also preserved in this epithelioid hemangioendothelioma. Then diagnosis. In the diagnosis, we can do a percutaneous biopsy can be done for the diagnosis, and then you can send the sample for histopathological examination. You can do a CT scan. In the CT scan, so you can do a CT scan, and if you do a CT scan, you will find that there is irregular hypodense lesions are found. There are irregular hypodense lesions are found with hypervascular enhancement in the periphery following the injection of the IV contrast. After injecting with IV contrast, we see presence of irregular hypodense lesions are seen with hypervascular enhancement. So this is seen on CT scan. Then treatment is, obviously, because it is a tumor of the liver, we can do a total hepatectomy can be done, where the total liver can be resected followed by liver transplantation. Actually, you can't do a hepatic resection because this epithelioid hemangioendothelioma is a diffuse disease and it is a multifocal disease. So this is not this you cannot do hepatic resection. You will have to do a total hepatectomy.
thank you and thank you for watching.